Production and distribution of City Club forums on IdeaStream are made possible by the generous support of PNC and the Raskin Family Fund, with additional funding from Robert Conrad, Cleveland State University, the Chautauqua Institution, the Cleveland Clinic, and the United Black Fund of Greater Cleveland, Incorporated.
Good afternoon. Good afternoon and welcome to the City Club of Cleveland. I'm Augie Napoli, President and CEO of the United Way of Greater Cleveland and a proud member of the board of the City Club of Cleveland. It's my honor today to introduce today's speaker, United States Senator Sherrod Brown. Opioid overdoses are now the leading cause of death in Americans under the age of 50. In recent years, the Drug Enforcement Administration has declared prescription drugs, heroin, fentanyl, as the most significant drug-related threats to the United States. Research from the Centers for Disease Control has shown that opioid overdoses from heroin and prescribed opioids have quadrupled since 1999. This has become an epidemic that spans all ages, communities, and demographics. Ohio is often referred to by the mainstream media as the epicenter of the opioid crisis. In 2016 alone, Ohio had the second highest number of drug-related deaths per capita in the United States, according to the Centers for Disease Control and Prevention. In the last year, many Ohio counties, including Cuyahoga County, reported their highest level of overdose rates ever and showed trends of more deaths involving opioids, methamphetamines, and cocaine mixed with fentanyl. There is some good news, however. A recent report by the State of Ohio Board of Pharmacy found that the opioid prescribing is down for the fifth year in a row. Between 2012 and 2017, the number of opioids dispensed decreased by 28.4%. In addition, the National Safety Council has given Ohio improving status for the state's work in implementing comprehensive proven actions to eliminate opioid overdoses. But is it enough? What else can we do to combat this crisis? And is it actually solvable? It is in this context that Senator Brown joins us. Senator Brown was first elected to the U.S. Senate in 2006. Prior to his election to the Senate, he served as a U.S. Representative for Ohio's 13th District. He served as Ohio's Secretary of State and a member of the Ohio General Assembly. Given his extensive political career, Senator Brown has made multiple appearances on the City Club stage as a speaker, panelist, and debater, and I learned this morning that this is his 26th appearance. He's the Steve Martin of the City Club of Cleveland. Senator Brown serves on several committees, including the Agricultural, Nutrition, Forestry Committee, and the Finance Committee, and the Veterans Affairs Committee. He also serves as a ranking member on the Banking, Housing, and Urban Affairs Committee. Senator Brown is up for re-election this year, facing challenger James Renacci this November. Prior to holding elected office, he taught democracy and government in Poland, as that nation was making the transition from Cold War communism to democracy. He's also taught in Ohio public schools and at The Ohio State University. Senator Brown is married to Pulitzer Prize columnist Connie Schultz, and both he and Connie live in Cleveland, Ohio. Ladies and gentlemen, please join me in offering a warm welcome to our Senator Sherrod Brown. Thanks.
Thank you. Augie, thank you. It's great to be back at the City Club. Thank you so much. When I walked in today, and Dan and Augie gave me this very cool City Club of Cleveland, Declaration of Independence and Constitution of the United States, I guess you might say it's more important than ever to have this. So I'll leave it at that, let you draw from that what you want. This is my first speech at the City Club since marrying Connie Schultz when Connie has not been here. Although when I walk in, it always happens if Connie's not with me. I like you, Senator, but I love Connie. So I am so used to that. I like hearing it, but it's not an original line for any of you that might use it. But she teaches at Kent State, as many of you know, and she had to be with her students today, of course, because she takes that so seriously. Connie and I were watching over the weekend. We couldn't be here last Thursday, not specifically here, but at the City Club. But Kerry Kennedy came in, as you know, and she spoke on the 50th anniversary. She was in Indianapolis the night before, spoke on the 50th anniversary of her father's address to the City Club. And what we took out of it is she spoke about poverty. It really does speak to the evolution of all of us. And I think we so appreciated the City Club sponsoring it and Anna Kennedy appearing on that very important date. Think back to the Ebola outbreak of 2014. Do you remember how many Americans contracted and died of that disease here in the United States? The answer is 0. When the outbreak began to spread beyond West Africa 4 years ago, our nation, our public health officials, marshaled our resources. We mobilized as a nation. Not a single American citizen who contracted Ebola here in the U.S. died from that deadly disease. Only 2 people contracted the disease on American soil. Both of them recovered. We stopped an epidemic here in the United States. We saved dozens, hundreds, probably thousands of lives here all around the world. Throughout our history, we've tackled threats to our public health. Yesterday, the opioid overdose epidemic killed 11 Ohioans. Today, it will kill 11 Ohioans. Tomorrow, it will kill 11 Ohioans. The day after tomorrow, it will kill 11 Ohioans. It's on the minds, it's in the daily lives of so many Ohioans across the state, including, I'm guessing, I'd be certain, some in this room. It's what I'd like to devote the next hour to today. As overdose deaths rise month after month after month, life expectancy in this country has actually declined 2 straight years. That's the first time that's happened since I was at Brinkerhoff Elementary School and Johnny Appleseed Junior High School in Mansfield, Ohio. It's a public health emergency. I'm calling today for a comprehensive, coordinated, sustained public health campaign through education, through prevention, through treatment, through recovery. We cannot accept as a nation that life expectancy will continue to decline, that families will continue to be torn apart, that entire communities, as we see, unfortunately, that entire communities will be written off. We don't have to. Let's look back for a moment. 1964, the last year we had 2 years of declining death rates, or of declining life expectancy. In 1964, 42% of American adults smoked. Then came the Surgeon General's report on smoking and health. It was the first time the government publicly connected tobacco with an increase in mortality. It sounds so simple and so obvious today. It wasn't so obvious 50 years ago. That report sparked a revolution. It kicked off a half-century fight against death and disease caused by tobacco, a fight that we don't let up on that continues today. The percentage of American adults smoking, remember I said 42% in 1964? Today it's 15% of adults smoke. The American Medical Association's journal estimates we've saved 8 million American lives. Before that Surgeon General report, public health efforts had rarely gone beyond infectious diseases. Tobacco was different. It seemed that everyone got involved. The federal government got involved. Public health officials got involved. Magazines took it upon themselves to refuse tobacco ads. Schools initiated efforts to curb student smoking. Doctors stopped touting the benefits of tobacco. You remember those ads in old Life magazines, if you're old enough to remember that, started asking patients about tobacco usage. Journalists exposed tobacco companies' criminal activities. Private organizations like Robert Wood Johnson invested millions in advocacy and research efforts to combat tobacco addiction. State and local governments restricted smoking in public places. Congress finally stood up to tobacco lobbyists passing legislation to require cigarette packages to display a warning. We banned TV and radio ads. Plaintiffs' lawyers and attorneys general brought class action suits introducing the idea of manufacturer responsibility. 1998, attorneys general of 46 states signed a master settlement agreement. The settlement agreement included a prohibition on tobacco ads aimed at children and young people. It created the organization responsible for the Truth Campaign. These efforts, as I said, saved 8 million lives and surely billions and billions in medical costs. We now have the tools to help prevent the next generation from falling into big tobacco's death grip. The same way we fight every year, because it needs to be fought every year against tobacco, needs to be fought every year to keep Lake Erie clean, we continue to fight this fight. 4 years ago, CVS Caremark announced it stopped selling tobacco products at its 8,000 American stores. Communities across the country, Upper Arlington and Cleveland, not often in the same sentence, Upper Arlington and Cleveland successfully passed initiatives to increase the age of tobacco sales from 18 to 21. And even though the bought and sold state legislature in Columbus has overturned local ordinances on gun safety and oil and gas drilling, they wouldn't dare overturn community efforts. They wouldn't dare overturn community efforts to protect our children from tobacco. Just last week, the FDA, at my request and a handful of other requests from a handful of other senators, announced plans to take action on flavors and e-cigarette products to help ensure they are not marketed to kids. Let's look at another deadly threat as we briefly recount this history to our public health. 1981, it didn't cause much of a stir in most of our country when the CDC's weekly newsletter reported 5 gay men in Los Angeles had all been treated for a type of pneumonia caused by a suppressed immune system. 2 of those 5 died. But more clusters of men with similar symptoms appeared in cities across the country. Scientists at CDC started to collect data and identify patterns and trends. By August 1982, the CDC coined a new name for this new disease, acquired immune deficiency syndrome we know as HIV/AIDS. Good data gave us the map we needed to people who contracted HIV before they showed symptoms. It's the same way we eradicated smallpox, the same way we identified people who might have been exposed to Ebola during the height of that scare 4 years ago. But HIV presented new challenges as a public health crisis that didn't appear to target all segments of society equally. Homophobia colored how everyone viewed this crisis, or whether they viewed it as a crisis at all. Before it was dubbed AIDS, the disease was originally called, you may remember this, GRID, gay-related immunodeficiency. Political leaders chose to ignore people who were politically convenient to ignore. A president denied its existence. We were unable to contain the spread of HIV as a result and advance treatment options as quickly as we could have and we should have. Our country failed and Americans lost their lives because of that failure. Eventually, thanks to the hard work of activists, we changed the conversation. HIV went from a disease that only affected those people to a problem we would all reckon with as necessary as a country. That spurred on more research, more investment, and a full-scale public health campaign that has saved so many lives. HIV mortality rates rocketed up and up through the 80s and the early 90s, peaked in 1995, but the good news, accelerated drug development and research led to antiretroviral therapy. The mortality rate has dropped more than 80% since its peak. Think about tobacco. Think about when we finally got it right on HIV/AIDS. What was once a death sentence is now a chronic condition that can be managed. We've made tremendous advances in stopping Americans from contracting HIV in the first place. We stepped up screenings. We identified people most at risk. We deployed targeted prevention campaigns. We funded research. We launched public health information campaigns. We educated students on safe sex and condom use. Overall response to the AIDS crisis obviously has been far from perfect, but the evidence is so clear and the lessons are so obvious. When we invest in comprehensive, coordinated public health campaigns, we save lives. Now, we've made some, I underscore, some important progress against opioids. Congress just passed an additional $6 billion to flow to local communities over the next 2 years. I made sure Ohio was first in line for that funding. This new investment should at least double the resources Ohio already receives from the 21st Century CARES Act that Senator Portman and I worked together to help pass last year. Rob and I come from different parts of the state, different political parties, different philosophies, but when it comes to fighting for this state, we work as a team. Senator Portman led efforts to pass the Comprehensive Addiction and Recovery Act, CARA, 2 years ago. I was proud to support him. Democrats and Republicans came together to pass my Interdict Act. President Trump signed it into law this year. Now, Customs and Border Protection agents can begin investing in high-tech screening equipment and lab resources to detect and stop dangerous drugs like fentanyl and carfentanil before they enter the U.S. Still, it's not enough, not even close. During my time in the Senate, I've held 300 plus roundtables, at least one in all 88 counties, nearly everywhere I go, whether I'm talking to farmers about the next farm bill or local businesses about creating jobs, this addiction epidemic comes up. I sat across from a father in Cincinnati who looked me in the eye and told me he nearly lost his daughter to the opioid epidemic. She was there that day. He put his hand on her shoulder, on her arm, and talked about her struggle. She was in her early 30s. She'd been struggling since she was 18 or 19. I've met far too many parents whose stories didn't have the happy ending that this one seemed to have. I've met with first responders overwhelmed by the number of overdoses they respond to every day. I've spoken to coroners who collect data and identifying trends, and these trends terrify them. One of my staff members was in Gallipolis on the Ohio River talking to the head of a local small bank, thinking he'd want to talk about small business lending. Instead, he wanted to talk about opioids. The epidemic of this magnitude demands a full-scale public health campaign to match it. It must consist of 3 parts. 1, education and prevention. 2, treatment. 3, recovery. We can learn a lot about all of this, about education and prevention, especially from our successes against tobacco. We can learn just as much from our failures elsewhere. The Just Say No campaign, deployed in the 1980s, cost about $1 billion and had almost no effect. By contrast, kids targeted by the FDA's The Real Cost campaign, aimed at tobacco, were 30%, those kids targeted were 30% less likely to start smoking. It was designed by experts, it was targeted, it was tested. We know what works, we should use that experience to develop a targeted and effective education campaign against opioids. Separately, we need to have real conversations about pain and the risks associated with drugs to treat it. Nobody's saying we should go back to the days when we ignored pain. Most of you have had a traumatic accident or been recovered from some place where you experienced a lot of pain. You know how important that is to alleviate pain. We need to encourage providers to screen patients for potential substance abuse disorders and to have meaningful conversations with patients about better pain management techniques. We took an important step when we removed pain as a factor in how provider payments are calculated. Something I heard from Ohioans about, something I asked Centers for Medicare and Medicaid Services to do something about. Medical schools should examine the amount of time they spend teaching the next generation of doctors about the risks and the benefits of different kinds of pain treatments. Congress has already provided some funding to the NIH for public-private partnerships to develop safer pain treatment options, but we need to do more to research and invest in non-addictive alternatives. Insurance companies should cover the alternatives we already have, like chiropractic services, the same way they cover addictive opioids. I wrote and circulated a letter to a number of my colleagues asking insurers to take those steps this year. We must combine those with better efforts to track the incidence of addiction. Remember how critical data was to tracking and stopping HIV and Ebola. We must employ those same strategies to track addiction if we're ever going to prevent it. Finally, drug companies must be held accountable. There's no reason they should be able to advertise addictive substances directly to patients, much less get a tax break for it. We held big tobacco accountable for its past abuses. Pharmaceutical companies played a role in fueling this crisis, and they're going to have to play a role in solving it. Of course, no matter how much education and prevention we do, some people will become addicted. We have to make it just as easy for Ohioans to seek treatment as it was to get opioids. Right now, 90% of Ohioans with a substance use disorder are not getting specialized treatment. How do you fix that? When the HIV epidemic was at its peak, Congress established Ryan White clinics to provide free specialized care. The good news is we already have community health centers in virtually every community of any size in this country. We already have community mental health clinics in many places. We need to give them the tools they need to meet increasing demand and make sure patients have access to their services. Remember that father in Cincinnati I told you about that sat with his daughter, his 31 or 2-year-old daughter? His daughter is alive today. He said, my daughter's here because of Medicaid. And yet, instead of working to strengthen the Medicaid expansion that saves lives across Ohio, President Trump and congressional Republicans have worked to eliminate it time and time again. And think about this number. Right now in Ohio, 200,000 people are getting opioid treatment because they have insurance under the Affordable Care Act. So my friends in Congress and in the White House ignored perhaps the most important rule of public health, of medical care generally. First, do no harm. The rapid rise in HIV also sparked significant investment in different treatment options. Today, a doctor can prescribe for more than 40 approved medications to treat HIV. We have just 3 drugs approved for medication-assisted addiction treatment. We need more. We need to require insurance companies to cover them. We need more doctors to prescribe them. We also need more treatment beds. Senator Portman and I have a bill to make more beds available right now by lifting what's known as the 16-bed rule. This 50-year-old policy prevents treatment facilities from serving more than 16 people at once covered by Medicaid. President Trump should take action to end that rule. We need to get people, at the same time, we need to get people into the beds we have. We've seen encouraging signs with states making naloxone more available to reverse overdoses and save lives. But having naloxone available will not make a dent in this epidemic if it's not followed up by getting the person into treatment and helping them manage their addiction. Ohio communities are beginning more effectively to understand that. Lucas County, Toledo has a program called DART, Drug Abuse Response Teams. After law enforcement's called in to respond to an overdose, law enforcement, first responders, fire departments, whatever, they partner with drug treatment providers. Teams make follow-up visits to the survivor's house. They offer counseling. They refer them to rehab facilities. They've had a 74% success rate getting survivors into treatment, much higher than almost anywhere else. Coleraine Township near Cincinnati has a similar program. They report that 80% of their overdose survivors have entered treatment. All over Ohio, innovative law enforcement officers are working to put people in treatment beds, not jail cells. We need to support jail cells. We need to support their efforts. The sheriff in Boone County, Kentucky, told the Cincinnati Enquirer, we can't arrest our way out of this crisis. We can't execute our way out of it either. We know because of the failed response to the crack epidemic of the 80s and early 90s. When African American communities were ravaged by addiction, our society treated it as a criminal justice problem instead of the public health crisis that it was. It is a civil rights issue. It's tragic. It's tragic that it took an epidemic ravaging white communities to change the conversation around addiction. But we finally see the national media, we finally see policymakers begin to see addiction as the public health problem that it has always been. Doesn't mean the criminal justice system won't be part of our efforts. You can't stop overdose deaths without aggressively going after traffickers. But as my friend and former head of the CDC, Dr. Tom Frieden, told me, it's not just that more people are using opioids, but the risk of dying among people using them has skyrocketed. Those deaths will continue unless we stop fentanyl and carfentanil and other deadly synthetics from being added to heroin and other opiates. The good news is we can employ many of the same tactics we learned from tracking the spread of AIDS and Ebola to track the flow of fentanyl and use new devices made possible by my Interdict Act to stop it at the border and keep it off Ohio streets. We have to do our part to support that work through public health, which brings us lastly to recovery. We need to rid ourselves of the idea that we're going to completely cure everyone of addiction. We haven't cured everyone of smoking. We expect people in AA will manage their alcoholism, for many so difficult, the rest of their lives. We've reduced the number of Americans dying from heart attacks, not because we've exactly cured heart disease, but because we have doctors with an arsenal of tools for helping Americans manage and prevent it. Regular checkups, recommended diets, statins, all of those kinds of things. What if every time any of us went to the doctor, we were screened for potential substance abuse disorder the same way we are for heart disease and other chronic conditions? What if, in addition to filling out a form disclosing allergies to medications, we answered questions about whether we struggle with or have a family history of addiction? You can do this without invasion of privacy, to be sure. And what if, when we went in for routine surgery, like a hip replacement, our doctors asked about any prior issues with addiction and then altered our care plan in pain management accordingly? Part of recovery is knowing what might trigger a relapse. Avoiding a professionally induced relapse after surgery is something we can, in the great majority of cases, correct. These efforts are going to take a healthcare workforce with an arsenal of non-addictive pain treatments, medication-assisted therapy, regular check-ins, and behavioral therapy. We need to support Americans struggling with substance use disorder the same way we successfully help Americans struggling with any other health condition. We never suggest somebody with diabetes take insulin for a year or two and then arbitrarily wean themselves off. We would never suggest that somebody struggling with depression stop seeing their therapist when their symptoms subside after a few weeks or months. There may be some people who need to be on medication-assisted treatment for a longer period of time than we normally think. Others may use 12-step programs. They may attend Narcotics Anonymous meetings for the rest of their lives. If we do this right, hundreds of thousands more Americans will never use an opioid. There will be hundreds of thousands more who have used opioids but whose lives are not lost or ruined, who are living with and managing their addiction. The same way we support individuals in recovery, we must support communities. I hear the same thing from mayors from Cleveland to New Philadelphia to Middletown to Chillicothe to Piqua. Employers can't fill openings because workers can't pass drug tests. Ohioans struggling with addiction can't find a job to help them get back on their feet, clearly. We already have federal grant programs that support addiction treatment. We have programs that fund workforce training. We know these programs can be successful separately, but this crisis requires them to work together. I'm introducing legislation this week to do that. My bipartisan bill will combine existing resources from the Department of Labor with the Department of Health and Human Services to fund combined addiction treatment and workforce training efforts at the same time. We know this model can work. We've seen it in Cleveland. We've seen it in Cleveland. Edwin's Leadership and Restaurant Institute here in Cleveland, many of you have eaten there. It's a really good restaurant too. Plans to open a restaurant in Medina later this year to hire and train individuals struggling with addiction for careers in the restaurant industry. My bill will build off of these success stories and fund more efforts like this. What I've outlined today is not an exhaustive list of everything. Threats we faced in the past rarely had one solution. Our fights against tobacco and HIV spanned decades, spanned cooperative presidents of both parties. It's why we need a full-scale, comprehensive, coordinated public health campaign designed by experts at NIH and CDC and Office of National Drug Control Policy and the Cleveland Department of Public Health and the Medina County Department of Public Health and all of us, informed by data and coordinated across public and private entities. The administration must step up, put partisanship aside, put experts in charge, and launch a public health campaign that will endure beyond the next election cycle. We have the best scientists and the best public health professionals in the world. We know how to do these things. We need the political will. On my lapel, many have talked about this in the past. Instead of the Senate pin, I wear a pin depicting a canary in a bird cage, given to me by a steel worker at a Workers' Memorial Day rally in Lorain about 20 years ago. I wear it as a reminder of the progress we have made in this country in public health. At the turn of the last century, workers took canaries down in the mines. As you know, because of a lack of oxygen or a poisonous gas, the worker If the canary died, the worker knew he had to get out of the mines. He didn't have a union that's strong enough or a government that cared enough to protect him. He was on his own. In the 20th century, we changed all that. Back then, a child born in this country would have a life expectancy about 45 years. We live 30 years longer today because of public health. We ended child labor, we made factories safer, we vaccinated our children, we wiped out diseases, we invented antibiotics, we passed civil rights and child labor and public health laws, especially for women. We reduced pollution. We cut deaths from heart disease and cancer and car accidents. Listen to this number. In 1950, the traffic fatality rate was 53 for every 100,000 licensed drivers. 53 for every 100,000 licensed drivers. By 2015, it had dropped to 16 per 100,000 licensed drivers. That was in large part because of good public safety laws. We ended smoking as a national pastime. We prevented epidemics from SARS to Ebola. We did it by expanding our sense of the possible, not retreating to partisan corners, but rising to the challenge together as a country. Our public health system has eradicated smallpox around the world, has nearly eliminated polio around the world, has dramatically reduced smoking, has ended HIV as a death sentence, has cut dramatically the number of Americans dying on our roads. Let's learn from our history. Thank you. Can I go back down there?
Today we're enjoying a forum featuring Senator Sherrod Brown. We're about to begin the audience Q&A. We welcome questions from everyone in the room. City Club members, guests, students, anyone who would like to ask the Senator a question, join us if you're not in the room via our webcast, and we'd be happy to entertain answers to those questions. If you'd like to tweet a question, please tweet it at the City Club, and our staff will try to work it into the program. Holding our microphones today, our Youth Forum Council member, Chair, Tiolu, did I pronounce that correctly? Tiolu Orisanya, and our content coordinator, Bliss Davis. May we have the first question, please?
There's a looming pension crisis that you've been working on to address. Can you explain what the problem is and the path forward?
Thank you for that question. There are 60,000 workers in Ohio, mostly Teamsters, mine workers, carpenters, iron workers, I mentioned carpenters. 60,000 mostly union plans, where workers over time at the bargaining table gave up wages today to put money aside for the future for their pensions. Most of those workers are facing, if Congress does nothing, a 40 or 50% cut to their pensions. And most of the reason for the difficult place the pensions have found themselves in was partly that so many companies have gone out of business with something called the Central States Plan, especially for Teamsters, because in some cases of Wall Street misfeasance and malfeasance, and because of what happened to our economy a decade ago. I am the chair of with Senator Orrin Hatch, an interesting combination, of a 16-member, 8 Republican, 8 Democratic pension committee. It's federal law that this pension committee be set up. It was set up at my request when I went to Senator McConnell and to Speaker Ryan and Ms. Pelosi and Senator Schumer also. It is federal law that this committee meet a number of times in the next year. We come up with a solution by December. It has to have 5 Republicans, 5 Democrats of the 8 in each party. We wrote it that way, so it would be bipartisan. The bill then will go directly to the House floor and Senate floor. No amendments, no committee action. It's the only way we think we could get a bipartisan solution to a very serious public problem. Thanks for asking.
Thank you, Senator. You referenced the cigarette issue and how we've cut smoking. At the end of the day, the cigarette companies have paid enormous damages through various trusts, et cetera, to help the states take care of the programs and all and compensate people. Do you see any prospect for a similar legal action for damages against the people making these opioids?
I don't know. It's a very good question. Thanks for that. I don't know if anybody this early in the tobacco campaign ever would have thought that it would lead to what you said it did, which is true. But I do think when you look at a couple of different actions out there now, there's a much heightened interest in Congress to move on this in a big way, all in the last 3 or 4 or 5 years. We didn't come to the game early enough, but it's mostly there now. You see what's happening in Judge Polster's court in Cleveland, where they've summoned people from all over the country that have interest in this, and this is a problem in every state, more severe in Ohio than most, but a problem everywhere. You see the cases in Ohio where a number of elected officials, from the Attorney General to the Mayor of Dayton to so many others who have come forward on this, and you see the stories of companies like Purdue Pharmaceutical that began to market OxyContin in the way that it did and sent its drug reps out all over the country arguing that this was not an addictive substance. Well, it may not have been addictive if it were administered in a hospital, but when they could make sure that people were observing. But when you give people pills and they take them home, something very different happened for addiction. So I think those companies will be held responsible. Whether in the end it is a big settlement, I assume it will cost them significant money to that handful of drug companies that have been very, very profitable. I think it will be all of that. Whether it reaches that magnitude is another question.
Senator, I saw that you were at the March for Our Lives in Columbus. What are some gun safety measures that you support?
Well, it's pretty clear what some of the things we need to do. You start with universal background checks, not just at gun stores, but gun shows and online sales. One of the most amazing and idiotic laws we have right now is if you're on the terrorist watch list, you go to Cleveland Hopkins Airport, you can't get on a plane, but you can go and buy an assault. You can buy an AR-15, even though you're on the terrorist watch list. I mean, we should ban assault weapons as we did 20 years ago. That ban expired. It wasn't as successful as anybody hoped it would be, but it was successful in terms of keeping assault weapons out of some people's hands. We should be doing all of those kind of common sense reforms. Now, what's different this time, perhaps, than any other mass shooting? What's different from Parkland versus what happened in Columbine, what happened at Sandy Hook, what happened in Orlando, what happened in Las Vegas? What's different this time is there seems to be staying power and sustained activity on the part of these young people on social media. We have students here from Brecksville, Broadview Heights, wherever they're sitting back there, who I would bet that some of them are part of that. And I bet after I said this today, more of them will become part of that. But what that tells me is young people are going to start walking up to people like me and to other candidates running for office and saying, how much money do you get from the gun lobby? I got a really good answer. I don't not only get money from the gun lobby, they spend millions of dollars to defeat me. But because, I mean, I have a lifetime grade from the NRA of F, and they come after people that do that. But the point is that what makes this different, because the one-issue voters on guns, the one-issue voters are people, or the 15 or 20% of people that will always defend the gun lobby. The 70 or 80% of the public that is on the other side, is on the side of we ought to have common sense gun safety rules. They normally don't vote that issue, and that may change, especially with young voters, especially when they ask politicians, any of us as candidates, how much money you get from the gun lobby.
Good afternoon. Hi. I'm Kristen Warzoka with the Greater Cleveland Food Bank. I know that you serve on the Senate Agriculture Committee, and we are glad that you do. We are very concerned about cuts to nutrition programs in the upcoming Farm Bill, particularly the SNAP program. Our early estimates are that if the proposed cuts to SNAP went through, we'd have to triple our distribution overnight at the Greater Cleveland Food Bank, and so would every other food bank across the country. I'm curious, I'd love to hear your insight on these proposed cuts or threats and what you aim to do about it. Thank you.
Thank you for that. Thanks for serving one of the great food banks in the United States. Thank you. Fortunately, over the last many years, the Farm Bill has had sort of two parts to it. One is all about agriculture. It's about conservation programs. It's about crop insurance. It's about a whole host of commodity issues, energy, rural development, that kind of thing. On the other side of the Farm Bill, as you know, is the nutrition program. And because of the wisdom of people decades ago, those two bills, those two entities were put together because people saw ahead that it would be that as fewer and fewer people in this country worked in agriculture, to pass a farm bill, you need more and more. You need more people than just farm states to pass it, in farm districts. On the other side, in order to beat back attacks like yours from the far right, to try to attacks like you mentioned on the far right, you would have that thought we shouldn't spend much of any money on feeding programs. Congress has put these bills together, understanding that rural interests help food interests, and food interests, feeding programs will help rural interests. The House of Representatives, again, wants to break that, and they want to continue to help farm states and farm districts. And Ohio's a farm state too in many ways, so I'm okay with much of that. But they want to they want to eviscerate the side of the feeding programs. Fortunately, senators in both parties, from Chairman Roberts, a very conservative Republican from Kansas, and Debbie Stabenow, moderate to liberal Democrat from Michigan, the ranking member, want to hold this together. I believe almost every member of the Senate Ag Committee in both parties wants to hold this together and resist those cuts. I mean, what people never like to, what the right wing never likes to think about or hear about or understand about these programs is, just like Medicaid, a whole lot of people in this country, and you know this, you see them at your food bank, a whole lot of people in this country work full-time and still need Medicaid, or work full-time and still need feeding food help and to food stamps. And those stories are into the hundreds of thousands or millions. It's important we remember that. And it may beg the bigger question of how many employers pay $10 or $12 an hour, including some big operations. Profitable companies pay $10 and $12 an hour, and their employees are eligible for food stamps and Medicaid and Section 8 vouchers and earned income tax credit. That's a fundamental issue of the dignity of work, and a fundamental issue about what we do about wages in this country. Thanks.
Senator, to what extent do you believe that our addiction epidemics are a canary in the coal mine for an economy that is failing a great many Americans?
I don't think there's any question of the link. I mean, it doesn't speak to the entirety of the problem, to be sure. I know you're not suggesting that, but you look where the problems have been greatest, at least initially greatest in opioid addiction. Read a book. I'm just forgetting a book called Dreamland. It's mostly about Portsmouth, Ohio, and Columbus, Ohio, and it speaks exactly to what you said. In smaller, more rural communities, and communities in cities of 30 to 50,000, like where I grew up, Mansfield's slightly bigger than that. In communities like that, where they lost huge numbers of industrial, good-paying, often union industrial jobs, where workers were making $20 an hour, 25 to 18, 20, 25 an hour. The plant closes, they or their children are then making $11 and $12 an hour. That doesn't cause addiction issues, but it certainly contributes to it. And it certainly may fill a void or a gap that people are kind of looking for. And I would contend that this is the first time in my lifetime where a lot of people who are 40, 50, 60 years old believe their children will not have materially a better life than they have. And that any expert I talk to thinks that contributes profoundly to this crisis.
Thank you, Senator. It's unimaginable to think someone would be in favor of addiction or in favor of a prolonged crisis. However, where do you see opposition to the steps that you're taking to fight the opioid crisis?
Well, the opposition, thank you, that's a very good question. The opposition is fairly latent and fairly not all that public, but the opposition in part is just from people that don't believe government has a bigger role in our lives. They don't want to spend public dollars. It's been a slog, even when Congress will there are a lot of happy talk speeches, a lot of good speeches in Congress about opioids. I mean, happy talk's the wrong word, of course, but a lot of speeches about opioids, and a lot of movement of legislation too. But when it comes to providing the dollars, they want to do it on the cheap. And I think if people, it's more of an ideological, if they're sort of far right and don't believe government has a role, they would, if they had heard this speech today, they would have kind of rejected this wholesale, we need a massive coordinated effort with the federal government and local communities and public health departments and individuals and the United Way and everybody else who can play a role in this. So I think it's more that, it's the same people. I mean, nobody's really against Medicare, but some sort of philosophically, I mean, you wouldn't think anybody's be against Medicare, well, because you see them go on TV, you see them there, you see conservatives that have kind of gone after Medicare, the far right, and they will run TV ads with their mothers saying, my son would never cut Medicare. Well, yeah, not for you, he wouldn't, but I mean, there is that sort of ideological break in this country that people choose these camps. So it will not be easy getting the president and getting legislative leadership of the majority party to come on board and let's do something dramatic and big. It's not big government, it's government coordinating all these things we know how to do. Again, the way we did with tobacco, the way we finally deal with HIV/AIDS, the way we did with Ebola, the way we did with the highway system. I mean, you look at the tremendous advances that we make with government coordinating with local communities, and it can make all the difference.
Senator, I'd appreciate it if you could comment on the proposed infrastructure plan that President Trump has put out.
Yeah, the president in his campaign talked about $1 trillion 10-year infrastructure plan. 5 of us in the Senate put together a 10-year infrastructure, $1 trillion infrastructure plan that would put real money into highways and bridges and water and sewer and broadband and community colleges and all of those things that made us a more prosperous country. I mean, from the 1940s and 1980s, we had the best, the infrastructure the world had never yet seen. And we now rank, and until into the 80s, we now rank about 15th in infrastructure because we simply haven't invested. The president, I think, struck a lot of chords in people when he talked about infrastructure. His proposals have been far too inadequate. His proposal is, when we introduced our bill this year for the second time, it actually funds $1 trillion of infrastructure. His bill will put $200 billion in federal money, 200 or 300, not clear, and leverage the rest to get to $1.5 trillion now. He's upped it. But local communities, I mean, look at our community here. Do we have the money to put out for infrastructure in a 3-to-1 match? Obviously we don't. There are 6,400 bridges in our state that have been declared inadequate by bridge inspectors, 6,400. Most of them, aren't the bridge over the flats. They're small community township bridges and all, but they all matter. And we simply aren't investing. And the president, I'm hopeful he steps up with real dollars in real infrastructure. When you had a state government cutting in half, and some of you are local officials, when you have a state government cutting in half the local government fund, and then you take away the estate tax funding, which really hits some communities all over the state, you simply don't have the dollars to put up. So I think his bill ends up being far too minimalist. He also took out provisions that they promised on Buy America, which I don't understand why we wouldn't use American iron and steel in these bridges and require them, that U.S. taxpayers would be much more likely to want to ante up by knowing that these would create jobs here. The last thing is, I think the president's relying on what people are now calling this bill Trump tolls. But you can toll a bridge over the Ohio River, but you can't toll water, sewer, bridges, highways, and broadband, all the kinds of things we need to do to really put this country back the way it should be. And we know that our most prosperous times as a nation have been when we have modern infrastructure, the likes of which nobody has seen. And that was in some sense our best, most prosperous economic days, and it's what we ought to do again.
Hi. What is your plan for a path to citizenship for the Deca children?
Yeah, I'll answer it this way. I was in Toledo a few months ago, and I met a young woman in her mid-20s. She came from Guatemala as a small child. Her life is Toledo. She doesn't know Guatemala. She speaks Spanish because her parents do at home, but she really doesn't know life in that country. She spent her first 4 years, and she's married. She's married to I didn't meet her husband, but I don't know if he's a DACA kid or not. She has a job. They have one car. She's active in her church. She does everything we want her to do. She's scared because she doesn't know what the president's going to do and what Congress's response will be. But here's what she told me. She said, my husband and I go to work every day. We have a 1-year-old child. I don't know who she leaves. I think she leaves the child with her parents. I don't know. But when we go to work, she said, before I start the car, I go out and I check the taillights. I check the headlight. I check the brake lights. When I stop at a stop sign, I count to 3. I never break the speed limit. And that's what she lives under. It's a little bit like the African Americans in this crowd. Every one of you has had that conversation with your dad or your mom over the years about how you drive. Something my parents, they talk about how I drove, but never things like that. And so I mean, these kids live under that threat. Time magazine this week has a story of a young woman at Lorain High School, Lorain, Ohio, the county west of here, and about how she lives day to day. And she's grateful that she gets to live in this country. She thinks she's going to get a good education. She might end up at Lorain Community College. Sorry if you're from Tri-C here. But she lives in Lorain, you know. Where would she go? But you can see the pressure. And these are kids. They're in our military. They're starting businesses. They're working. If they commit crimes, they should be deported. But why is this government so mean-spirited about this when these kids are, these kids are overwhelmingly doing the right thing? So I think we'll eventually do the right thing here. We should do it sooner rather than later. I hope it doesn't take TV footage and online footage of agents beginning to deport these kids because the expiration date has passed and the court's not intervened and the president hasn't intervened. I hope it doesn't take that to get us to do the right thing.
Hi. My question really is about the federal court system. I went to a program last week sponsored by the NAACP, and National Council of Jewish Women was there also, opposing the nomination of Tom Farr for the Eastern District of North Carolina. Their research shows that he's a racist, a bigot, and all the other reasons you wouldn't want him to be on the court. Forget about how he might view politics left and right, but he's just an unqualified jurist to be in a lifetime appointment. What do we do to make sure that people like that don't get on the court, number one? And the other part of it I found fascinating is apparently President Obama twice appointed or named someone to that seat, an African-American woman, 2 different times. There were never even hearings on her qualifications. She may or may not have been qualified, but they didn't even hold hearings. What do we do to make sure our courts aren't ruined by what's going on currently?
Well, I'd say we have elections every 2 years. That would be one of the ways, or the most obvious way. The Senate, go back 2 years to what Senator McConnell did with Merrick Garland. Unprecedented. He says it wasn't unprecedented. It was. Technically, he could find a way to say this was not unprecedented. But for 10, 11, I think 12 months, 10 months before the election, 12 months before the new president, Merrick Garland didn't even get a hearing. That happened in far too many Obama appointments. I understand the last 3 months before an election, but not a year out, because then it's 1/4 of the time. I mean, how do you ever argue democracy stops, the judicial system stops in terms of replenishing it one out of 4 days in any cycle? So I don't know what's going to happen with him. I would assume that probably every Democrat votes against him, and he needs, then if two Republicans vote against him, he's defeated. We have found incredible party discipline on the part of McConnell's party on nominees and appointments. We've also found incredible party discipline on allowing this president's behavior to continue. And you can try to ask, why is that? Part of that is conservatives like what they're getting out of this government right now. They're getting conservative federal judges, you suggest, Sue Ellen. They're getting weaker environmental laws. They're getting attacks on the labor movement and on voting rights. They're getting a tax cut that they want that's overwhelmingly loaded to the wealthiest people. And I think that my colleagues are afraid of their political base. Fundamentally, they know that 75% of Republicans, of primary voters. I mean, there are 2 polls recently that said that over 60% of Republicans in this country think the President of the United States is a good role model for their children. You start with that. So I think the answer to that kind of political action on their side is the same kind of political action if you disagree with these nominees. I don't know what this guy's future is. I've heard a lot about him. I think there's special attention paid to him. But the White House has nominated both in the 6th district here and local district, 6th circuit, Ohio, Michigan, Kentucky, Tennessee, and on district judges, northern and southern districts in Ohio, out of Cleveland and out of Cincinnati, have nominated not just very conservative judges out of the Federalist Society, they've also nominated very young judges, late 30s, early 40s. So I just think pay special attention and engage every possible way you can. I think if the Democrats take the Senate, you'll see a different kind of judge that President Trump will nominate because he will have to.
Thank you, Sherrod. What a wonderful session this was. Really enjoyed your remarks. We appreciate it. Today at the City Club, we've been enjoying a forum featuring Senator Sherrod Brown. We welcome guests at tables hosted by Citizens Bank, Cleveland Clinic, the Cleveland Neighborhood Progress, Cuyahoga Community College, Friends of Sherrod Brown. Friends of Sherrod Brown, you're back there. And additionally, we welcome students from the Brecksville Broadview Heights High School and Flow Homeschool Co-op. Student participation in the City Club forums is provided by many foundations, including the William M. Weiss Foundation. We thank all of you for being here today and supporting the City Club of Cleveland. That brings us to the end of today's forum. Thank you, Senator Brown, and thank you, ladies and gentlemen. This forum is now adjourned.
For information on upcoming speakers or for podcasts of the City Club, go to cityclub.org.
Production and distribution of City Club forums on IdeaStream are made possible by the generous support of PNC and the Raskin Family Fund, with additional funding from Robert Conrad, Cleveland State University, the Chautauqua Institution, the Cleveland Clinic, and the United Black Fund of Greater Cleveland Incorporated.